Hello guys, welcome to my channel. Let's discuss Ask the Doctor. I'm Dr. Babalola by name, your host as always. If you are yet to subscribe to this channel, kindly subscribe because I'll be dishing out content that's going to be of benefit to you as far as health is concerned. So let's get started. In my previous video, I discussed the concept of hypertension and I give a detailed analogy as it relates to car engine as well as the body engine, which is the heart itself and how the blood is being pumped through the blood vessel. If you are yet to watch that video, go through the description below to watch the video because it's going to be of value to you. Today, as a continuation of that particular video, we are going to be discussing the signs and symptoms of hypertension, complications, what will result if an individual do not manage the hypertension very well, and what are the preventive measures. I'm sure these are the things you don't want to miss out of as I'm going to take you through this journey. So let's get started. So what are the signs and symptoms? What are those things you are going to notice in an individual or even in yourself that make you feel, oh, there will be need for me to check my blood pressure, or there will be need for me to go for a thorough checkup? Number one of the signs and symptoms, and not in any order, is that you possibly notice this headache. The headache might just come either in association with any other symptoms or on its own. If you are the type that without any other symptoms, you have an headache, maybe after being stressed out or without being stressed out, there will be need for you to check your blood pressure. The reason why you need to check your blood pressure is for you to be able to know that, okay, if there are other things resulting to that headache or it is truly high blood pressure that is causing the headache. The other thing to look out for in an individual that has high blood pressure is nosebleed. If an adult out of the blues just come down with a sudden nosebleed, there will be high sense of suspicion for one to check the blood pressure of an individual, because nosebleed results to the trauma to the small vessel in front of a nasal cavity. Those blood vessels are very tiny, and if there is the possibility of a sustained increase in blood pressure in an individual, such tiny blood vessels could be damaged in an individual that has not been taking note of their blood pressure for a while. So one of those symptoms could be nosebleed. The other symptoms that you could notice in an individual is palpitation, this persistent heartbeat. Normally when your heart is beating, you are not meant to even perceive or be conscious of that. As I'm talking, my heart is beating and I'm not conscious of that. By the time you are becoming aware that your heart is beating, regardless of what you are doing or regardless of the period of the day, there is that need for you to check your blood pressure. The other symptoms that you could notice is anxiety. You are just anxious, you are restless, you don't even know what you are doing, you are confused. Confusion, anxiety, restlessness. These are other forms of symptoms that could be associated with hypertension. Note, like I said in my previous video, hypertension means sustained high blood pressure. And when the high blood pressure is sustained, it shows that the pressure at which the blood is being pushed through the blood vessel, it is now above the normal range expected. So when something is above the normal, it shows that the organs, the blood that is being pushed into, that the blood is being circulated through or into, they are also being affected by this increase in pressure, because the blood is flowing at a pressure that is above what is expected and above what the body is used to. So there will be need for you to check your blood pressure when you see any or all of these symptoms. The other things that you could also notice in an individual is weakness of certain body parts. And it's unfortunate, it is when an individual had actually had the complication of hypertension, in which we are going to mention, but I'm going to state one of them now, which is stroke. And as a matter of fact, there is a preceding episode which we call transient ischemic attack, TIA, which means just a little episode to just test an individual to just alert you that, oh, there's tendency of stroke coming over. So what happened in those individuals is that they notice that they have weakness in certain body part for a short period of time, and spontaneously it regains itself. So to those individuals, if they're not being careful, they feel, oh yeah, it's just one of those, I just experienced that weakness for a while, within 24 hours, it disappears. You shouldn't joke with such a sign. So these are just few of the many signs. And like I always do tell people, whenever you notice any abnormality in your body, do not wait to experience the second episode before you go to assess care and be evaluated further. So when you notice any of those itemized symptoms and signs, I advise you check your blood pressure, and you also go ahead to be evaluated at the nearest health care facility. So having told you the signs and the symptoms, what are the complications that could result from hypertension? Complication will only occur if an individual is hypertensive and the individual refuses to manage the hypertension well. Note again, complication will only occur if an individual is hypertensive and the individual refuses to manage the hypertension very well. If the individual manages the hypertension very well, there is that tendency that complication will never occur. So what are those complications, so that you have an idea, and then it will help you to be able to work towards prevention rather than allowing the hypertension to progress into becoming something that will result into complication. And complication can also occur when an individual is placed on medication and the individual refuses to comply with the medications either regularly or by not even taking it at all. The other reason why complication can also occur is when an individual refuses to even go for a checkup to even know their status of either being hypertensive or not hypertensive. So these major reasons are why people tilt towards coming down with complications. I said either by not complying with medication, not taking it regularly, or not taking it at all, or by not even going for a checkup to even know your status. So if these three things happen, definitely hypertension will not wait for your ignorance, and hypertension will not say because your ignorance is not going to proceed and progress into leading to those complications. Therefore, I advise today, if you have not known your status, I advise you make the checking of your blood pressure a regular activities. When I say regular activity, it means if you are of that age of 35 and above, checking your blood pressure and at an average of once in 3 months is not out of place. It's not out of place. If you are the type that is even managing blood pressure, checking your blood pressure regularly is even advised. But for those that are not even hypertensive, we advise that you check your blood pressure if you are 35 years and above at least once in 3 months. And there's nothing bad in checking it once in every month. It's not out of place. Mind you, I'm not an advocate of a daily blood pressure check. If you cultivate the habit of checking your blood pressure daily, it creates an undue tension and anxiety in you that can even trigger any form of increase in blood pressure whenever you want to go and check it. As a result of that, I don't advocate you check your blood pressure daily, except you are the type that is managing hypertension already. And if you are managing hypertension already, if you are taking your medication regularly, over time you might not even need to be checking it every day. Please take note of this. So what are those complications? Number one, stroke. I'm sure we've heard of stroke, and as a matter of fact, a lot of people that don't want to talk about hypertension is because of the fear of stroke. Stroke will not occur if you are an individual that take necessary precautions and comply with your medications and your doctor's prescriptions. If you comply with your doctor's prescriptions regularly, the tendency of coming down with stroke is very, very low. So stroke is one of those complications that can occur because the individual had refused to adhere to necessary precautions like taking medications regularly and lifestyle modifications. The other complication that can occur is aneurysm. Aneurysm means rupturing of the major blood vessel. I told you there is a normal pressure that is expected to push blood across the blood vessel But when this pressure is very high and it is sustained for several years, it is endangering the major blood vessels, such as those blood vessels that are leading to the heart itself. So this is one of the complications. Those blood vessels can rupture, and when they rupture, is an emergency that can lead to death. So you don't want to have anyone that will experience this. If you must prevent this, you need to adhere, starting from knowing your status, checking your blood pressure regularly, and if you are an individual that is hypertensive, or you know an individual that is hypertensive, counsel them in taking and complying with their doctor's prescriptions, as well as lifestyle modifications. The other thing that can occur as a complication is heart failure. Heart failure can occur from hypertension because of the same mechanism I mentioned. The other complication is kidney failure. Kidney failure can occur from hypertension as well. Kidney is one of those organs in the body that helps to regulate the blood pressure. But over time, because of the pressure through the blood vessels across all the body system, including the blood supply to the kidney itself, over time it leads to kidney failure. And as a matter of fact, as a general norm, as a general concept, anywhere that the blood vessel leads to in the body can experience complication as a result of high blood pressure. So one of the complications that can result from hypertension is also blindness, because over time the eyes is supplied with all those small blood vessels to supply the blood to it. And when there is persistent increase in blood pressure across them, what happens is that they rupture, those small blood vessels rupture. And when they rupture over time, where the blood vessel is meant to supply blood to and oxygen to, begin to live in hypoxia. What it means is that they begin to live in deficiency of oxygen. When there is no oxygen supplied to such part of the body over time, such part of the body loses its function, and that's how it progresses into blindness. So these are just few out of the many complications that can occur from hypertension. So if you must prevent this complication from occurring, what I advocate and I advise is that you know your status. Having known your status, if you are not hypertensive, continue your healthy lifestyle. If you are hypertensive, adhere to your medications and also good lifestyle that will be mentioned. So let's progress now to preventive measures. What are those preventive measures? Number one, reduce salt intake. Note, I didn't say cut off salt intake. Your salt intake is to blood pressure control. Your sugar intake is to your diabetes control. So each of them is different. I said reduce your salt intake. As a matter of fact, I always say if you are 35 years and above, in this dispensation, the need to cut down on your salt intake is definitely necessary. What salt intake does is that it helps to reduce the volume in circulation. In volume means is that it reduces the plasma volume. Plasma volume is that additional fluid that is added to your red blood cell in the blood vessel. So when you reduce salt intake, salt, what it does is that it retains water inside the blood vessel. But when you reduce the salt intake, the ability of the body to retain water inside the blood vessel is cut lower, is reduced, thereby helping you to now reduce those things that will form bulkiness in the blood vessel that will now require more force and more pressure to push them through. So when that load within the blood vessel is reduced, definitely the pressure to push the little load that is remaining in the blood vessel will definitely reduce and come to normal. So that is just the simple layman language to explain the need for the reduction of the salt in your daily meal. So if you are the type that buy food from outside, the need for you to cut down on the frequency of salt is very necessary, because you do not have control over those restaurants, but you have control in your own home, whereby you can actually control the quantity of salt you put in your meal. So reduce salt intake. Reduction in salt intake have been noted to have had a great and a booster effect in the prevention of high blood pressure or hypertension in an individual, and in also managing blood pressure in people that are down with hypertension. So it's a form of lifestyle modification. The other lifestyle modification you need to adopt is avoid sedentary lifestyle. Reduce physical inactivity. Reduce physical inactivity. What it means is that you should always ensure that you engage your body and your muscle system in daily activity. Daily activity ranges from you taking a walk down the street, or taking a walk within your office or within your home. And as a matter of fact, it's been recommended that an average of 30 minutes daily exercise for an average of 5 days in a week is okay for a healthy lifestyle and for your heart. An average of 30 minutes exercise for 5 times a week, which is 150 minutes exercise in a week, is definitely good for a healthy lifestyle. Some people will also say and dispute this, that their daily activity is such enormous and so stressful that they do not need extra exercise. What I do tell them is that if it's not going to exercise your heart and make it to be healthy, it's not good enough. So the number 3 point is aerobic exercise. When we talk about engaging in aerobic exercise, it means you trying to do basic exercise at least 30 minutes a day for at least 5 times a week. For those that work in formal settings that do not have time for the usual gym or for the usual street walk, we encourage them to get this particular form of wristwatch that help them to calculate the number of steps taken per day. If you can take an average of 10,000 to 15,000 steps per day, it's quite enough to accommodate for the exercise expected for you as an individual. I haven't discussed this today, the symptoms and the signs of hypertension, the complications of hypertension, and I haven't told you the preventive measures. I'm sure you've been able to get value through this video. Feel free to share the video, click the like button, and also subscribe if you are yet to do so. Thank you for watching. See you some other time.